Hello, everyone. Today, we are going to focus on the diseases of young animals. Our main goal is to understand not only what these diseases are, but also why they differ so significantly from the pathologies we see in adult animals. So, today's agenda: classification of diseases in young animals, age-related physiological features of young animals, immune protection in newborns, and iron deficiency anemia, focusing on piglets, to be covered in detail in the next video. Now let's look at how we classify these diseases based on when they occur. First, we have antenatal diseases. These conditions develop inside the uterus before the animal is even born. Common examples include fetal hypotrophy, where the fetus is underdeveloped, and congenital malformations, such as heart defects or atresia ani. Second, we have intranatal diseases. These are pathologies that occur during the labor process itself. Clinical examples include asphyxia, a lack of oxygen, birth trauma, or umbilical cord hemorrhage. Moving forward, we have the neonatal period. These diseases appear during the first few days of life. Examples include omphalitis, also known as navel ill, neonatal sepsis, and diarrhea syndrome. Finally, we reach the postnatal period. These diseases develop later in the young animal's life, after the initial neonatal stage. Examples of postnatal pathologies are bronchopneumonia, various nutritional deficiencies, and secondary gastrointestinal infections. Understanding this timeline is the first step in identifying the root cause of the problem. To better understand the difference between a fetus and a newborn, let's first consider the features of their blood circulation. Now that we understand when these diseases occur, we must ask ourselves, why is the young animal so vulnerable? To answer this, we need to look at the age-related physiological features. In the fetus, the heart does not separate oxygenated and deoxygenated blood perfectly. Instead, it is a system of controlled mixing. The fetus gets oxygen from the placenta, not the lungs. There are three main points of mixing. In the liver, oxygenated blood from the placenta meets deoxygenated blood from the abdominal organs. In the right atrium, this is the most important part, oxygen-rich blood from the posterior vena cava meets oxygen-poor blood. In the aorta, after the carotid arteries branch off, the ductus arteriosus joins the aorta. Through this bridge, a large amount of deoxygenated or poor blood from the right ventricle flows into the descending aorta. What happens at birth? The fetus moves from the intrauterine to the extrauterine environment. Once the placental connection is lost, for a short time, the newborn lacks oxygen. We call this transient hypoxia. In addition, the level of carbon dioxide in the blood increases and respiratory acidosis develops. This chemical change signals the respiratory center of the brain. It is located in the brainstem, specifically in two main areas, medulla oblongata and the pons. The brain then commands the lungs to take the very first breath. The lungs fill with air and expand, pulmonary inflation. Blood flows more easily into the lungs because resistance drops. The blood changes its path. It is now redirected to the lungs to get oxygen. The ductus arteriosus, the bridge between the heart's main arteries, is no longer needed and starts to close. After the lungs start working, pressure in the left heart rises and closes the foramen ovale. It becomes a wall. Look at this image. It shows how the heart changes its function immediately after birth. Fetal heart, before birth, you can see two shortcuts: foramen ovale, an opening between the right and left atria; ductus arteriosus, a vessel connecting the pulmonary artery to the aorta. Newborn heart. The change is the first breath opens the lungs. Pressure in the left heart rises and closes the foramen ovale. It becomes a wall. The ductus arteriosus constricts and closes within hours or days. Result: the heart now works as two separate pumps, left and right, just like in an adult. Let's explore the features of thermal regulation in newborn piglets. They have immature thermal regulation, and body temperature is highly dependent on environmental temperature and physical activity. Newborn piglets are extremely sensitive to cold due to a lack of brown adipose tissue and thin subcutaneous fat. Unlike other farm animals, piglets are born without a thick hair coat. This lack of natural insulation means they lose body heat almost immediately to the environment. In addition to this, newborn piglets have very limited glycogen stores in their liver and muscles. When a piglet experiences cold stress, it is forced to burn these reserves rapidly to maintain its body temperature. In the first hours of life, warmth is just as critical as nutrition. Understanding the consequences of cold stress is vital for any clinician. The most immediate threat is hypoglycemia. Because piglets have no fat and little glycogen, cold temperatures force them to exhaust their glucose levels just to stay alive. Cold stress also leads to gastrointestinal disorders. There's also a significant behavioral risk. Cold piglets seek warmth by huddling close to the sow, which drastically increases the risk of crushing and death. Finally, remember this critical number. The lower critical temperature for a newborn piglet is 34 degrees Celsius. Anything below this requires the piglet to use its own energy just to maintain its core temperature. We now come to what we call the energy crisis. Unlike other species, they are born with no thick fur and almost zero body fat. Their only internal tower source is a tiny amount of glycogen stored in the liver and muscles. In a cold environment, the piglet is forced to burn this glycogen to maintain its core temperature. If the piglet does not receive colostrum immediately, these internal reserves disappear within just a few hours. This leads to a dangerous descent into hypoglycemia. Once the glycogen is exhausted, blood sugar levels crash. At this stage, the piglet enters a state of clinical collapse. It becomes lethargic, and most importantly, it loses its suckling reflex. This is a critical turning point. The piglet is now too weak to reach the udder or consume the milk it so desperately needs. This creates a fatal, vicious cycle. Without new energy from colostrum, the body completely loses its ability to produce heat. As the core temperature continues to fall, the piglet's metabolism shuts down, leading to a coma and ultimately death. This cycle proves that the first hour of life is literally a race against time. Our primary goal as clinicians and producers is to provide that fuel before the energy crisis becomes irreversible. Now let's look at the features of thermal regulation in newborn calves. Compared to piglets, calves have several biological advantages. First, they utilize non-shuddering thermogenesis. Calves are born with moderate reserves of brown adipose tissue. This specialized fat provides immediate heat production on a chemical level. Think of it as a metabolic bridge. It keeps the calf warm until the muscular system can begin shivering and the calf can take in its first colostrum. Second, calves benefit from their body size. Because they are larger, they have a lower surface area to mass ratio. This anatomical advantage significantly reduces the rate of heat loss, making them much more resilient to cold stress than piglets. Unlike piglets, a newborn calf is born with a hair coat that provides significant natural protection. However, you must remember that the efficiency of this insulation drops significantly if the hair is wet or if the animal is exposed to drafts. Moisture and moving air strip away the warm layer of air trapped near the skin. For a dry, healthy newborn calf, the lower critical temperature is approximately 10 to 15 degrees Celsius. This is much lower than the 34 degrees required by piglets, which shows the calf's superior resilience. Now, let's look at lambs. Unlike piglets, lambs are born with significant reserves of brown adipose tissue. This specialized fat allows them to generate heat without shivering. It is their primary internal heater. It is an evolutionary adaptation for surviving birth in cold, windy pastures. However, they lose heat rapidly if their wool is wet. The ewe must lick the lamb dry immediately. Drying fluffs up the wool, creating an air barrier that provides essential thermal insulation. Without dry wool, even the best internal fat reserves cannot prevent hypothermia. Foals have very little brown fat. Instead, they rely on a high metabolic rate and intense muscle activity, shivering, and movement. They are born ready to run, and this movement is their main way to stay warm. Foals are very sensitive to drafts, air movement, because of their thin skin and short hair coat. The breathing pattern in neonates is predominantly abdominal and characterized by an irregular rhythm. You will notice uneven pauses and an alternation between deep and shallow breaths. This system is highly sensitive. The respiratory rate increases rapidly in response to any stress or external stimuli. Anatomically, newborns, especially piglets, are immature. Their bronchi are narrow, with poorly developed muscular and elastic fibers. This creates a high risk of airway obstruction if mucus accumulates. Finally, the lung tissue itself is highly vascularized, or full-blooded, but has low elasticity. Combined with reduced surfactant activity, this often leads to physiological atelectasis, where parts of the alveoli remain collapsed. Understanding these limitations is crucial for managing neonatal respiratory distress. Now, let's examine the functional features of the digestive system in newborn piglets. The first thing that stands out is the incredible rate of rapid stomach growth. At birth, a piglet's stomach capacity is only 25 milliliters. However, by 2 months of age, it expands to 3 liters, and by 1 year, it reaches up to 4 liters. This rapid expansion requires high-quality, easily digestible nutrients. The most critical clinical feature, however, is age-related achochloridia. Newborn piglets have an absence of free hydrochloric acid in their gastric juice. This deficiency lasts until they're about 25 to 30 days old. Without hydrochloric acid, the stomach cannot activate certain enzymes or act as a barrier against bacteria. While the stomach is still maturing, intestinal digestion is already highly developed at birth. This allows the piglet to efficiently process the complex nutrients found in colostrum and milk immediately after the first feeding. The digestive anatomy of a newborn calf is quite unique. At birth, the total stomach capacity is roughly 2.5 to 3 liters. However, unlike adult cattle, the abomasum, or the true stomach, is the only functional compartment, making up about 70% of the total volume. The rumen and omasum remain underdeveloped at this stage. One of the most critical biological adaptations occurs in gastric secretion. During the first 24 to 36 hours of life, the gastric pH is relatively high, staying between 4.5 and 5.1. This low acidity is intentional. It prevents the activation of pepsinogen into pepsin. Low acidity prevents pepsinogen activation, which is a vital adaptation to protect colostral antibodies from digestion. As the calf grows, we observe the fascinating process of rumination development. Although the rumen is non-functional at birth, the first attempts at chewing the cud, or rumination, appear remarkably early, typically between 9 and 12 days of age. However, full-fledged, consistent rumination is only established by 2 to 3 weeks of age. In the beginning, rumen contractions are very weak, short, and infrequent. The muscular layer of the rumen must be physically stimulated by the presence of roughage to develop the strength and rhythm we see in adult cattle. Monitoring the onset of these contractions is a key clinical indicator of a healthy digestive transition. Let's shift our focus to the nervous system of newborns. From the first minutes of life, we observe a complex set of reflex activities. Animals are born with fully functional, unconditioned reflexes, which are essential for immediate survival. These include the sucking and swallowing reflexes for nutrition, the righting reflex to stand up, and the mammary seeking behavior. However, their learning ability is limited at first. Conditioned reflexes are completely absent at birth. They only begin to form a few days later as the cerebral cortex matures and the brain begins to process environmental signals. Finally, we must consider autonomic regulation. In neonates, the autonomic system is characterized by a naturally high heart rate, known as physiological tachycardia. In calves, for instance, a normal heart rate ranges from 80 to 130 beats per minute. Additionally, respiratory arrhythmia is a very common and normal physiological finding in these young animals. As a clinician, it is vital to distinguish these normal neonatal features from pathological signs. We have discussed how animals struggle with breathing and heat production, but beyond the physical environment, there is a hidden biological threat: pathogens. Even in a warm barn, a newborn can still perish without an immune shield. This brings us to our next critical topic: immune protection in newborns. Now we come to one of the most critical concepts in neonatal immunology: the placental barrier. In farm animals, such as pigs, cows, horses, and sheep, have an epitheliochorial placenta. This is the most complex placental type, consisting of 6 distinct tissue layers that separate the maternal and fetal blood supplies. Because this barrier is so thick, large molecules like immunoglobulins cannot cross the placenta during pregnancy. This leads to a critical clinical state. Young animals are born A-gamma globulemic, meaning they have 0 antibodies in their blood at birth. Consequently, they are 100% dependent on colostrum for their initial passive immunity. For example, a calf born from a vaccinated cow is still born unprotected until it consumes colostrum. For these species, the first drink of colostrum is not just a meal, it's a life-saving immunological transplant. Natural breastfeeding does more than just deliver nutrients. It triggers the release of oxytocin within the newborn's body. This hormone acts as a powerful regulator, increasing blood flow to the intestinal tract and significantly stimulating the absorption of immunoglobulins. This is why natural suckling is always superior to bottle feeding or using a pacifier. Immunoglobulins enter the body of newborns only with colostrum, colostral immunity. The presence of a small amount of it in the blood serum of calves before colostrum feeding is due to its own synthesis. A high concentration of immunoglobulins in a pre-colostral calf is a major clinical red flag. It usually indicates an intrauterine fetal infection, as the fetal immune system was forced to respond to a pathogen while still in the womb. When assessing colostrum, the concentration of immunoglobulins in colostrum is the main criterion of its quality. We categorize colostrum into 3 clinical grades. High-quality colostrum must contain at least 60 milligrams per milliliter. This is what every newborn needs for a strong start. Medium quality ranges from 31 to 59 milligrams, while anything below 30 milligrams is considered low quality. Feeding low-quality colostrum significantly increases the risk of failure of passive transfer, leaving the animal unprotected. It is a common misconception that colostrum is only about antibodies. In reality, it provides a comprehensive biological defense system through several bioactive components. First, colostrum contains cellular factors. It is literally a living fluid containing maternal lymphocytes, neutrophils, and macrophages. These cells migrate into the newborn's tissues to provide immediate active surveillance. Second, we have non-specific proteins like lysozyme and lactoferrin. Lysozyme directly destroys bacterial cell walls, while lactoferrin binds essential iron, starving pathogenic bacteria of the nutrients they need to grow. Finally, colostrum is a powerhouse of energy and signaling. It provides high-density lipids for thermal regulation and growth factors that stimulate the rapid maturation of the newborn's intestinal tract. Understanding this complexity helps us realize why synthetic milk replacers can never fully replicate the protective power of natural colostrum. Time is the most critical factor in neonatal survival, and this is due to the gut closure phenomenon. We often talk about the golden hour. This is the first 2 hours of life when the intestinal epithelium is most permeable, allowing for maximum absorption of immunoglobulins. However, this window of opportunity closes rapidly. By just 8 hours after birth, the efficiency of absorption drops by 50%. While intestinal closure is typically complete within 20 hours in healthy calves, we must be extremely cautious with stressed or hypertrophic animals. In such cases, early closure can occur, making the gut impermeable to antibodies as early as 4 to 12 hours after birth. Your main rule should be every minute of delay is a loss of protection. Efficiency of passive immunity depends largely on maternal management. First, dietary deficiencies. A lack of protein and keratin in late pregnancy impairs the development of fetal enterocytes, reducing their ability to absorb antibodies later. Second, prepartum milking. Extracting colostrum before calving is a critical error. It flushes out the concentrated immunoglobulins, leaving the newborn with a diluted, low-quality product. Finally, antibiotic overuse. Excessive therapy during the dry period can interfere with colostrum quality. Remember, successful immunity starts in the dry period, not just at birth. The physiological state of the neonate at birth is just as critical as the quality of colostrum. First, acidosis and hypoxia. Difficult labor or dystocia leads to high CO2 and lactic acid levels. This drop in blood pH directly inhibits the transport mechanism of immunoglobulins across the intestinal wall. Second, fetal immaturity. We often see physiological immaturity in calves from primiparous cows, heifers. Their digestive and circulatory systems are simply not yet optimized for efficient absorption. Finally, fever. Any elevation in body temperature above 39 degrees Celsius acts as a metabolic stressor that disrupts normal neonatal physiology. Finally, we must consider the environmental and pathogenic factors. First, microbial challenge. If a calf's intestine is contaminated with bacteria or viruses before it drinks colostrum, these pathogens occupy the receptors on the enterocytes. This literally locks out the antibodies, preventing their absorption. Second, air quality. High levels of harmful gases like ammonia in the maternity pen act as a systemic stressor that suppresses neonatal reflexes and metabolism. And third, the microclimate. Low temperatures below 10 degrees Celsius combined with high humidity lead to cold stress. This redirects the calf's energy away from digestion and toward thermoregulation, drastically reducing the efficiency of passive immunity. Clean air and a dry, warm environment are just as important as the colostrum itself. In conclusion, the survival and future productivity of an animal are never matters of chance. They are the direct results of precise biological processes. A profound understanding of the physiological transitions at birth, from the first breath to the stabilization of thermoregulation, alongside a mastery of neonatal immune defense, is the most powerful tool in a veterinarian's arsenal. When we understand how these systems adapt during the first hours of life, we gain the ability to raise healthy, resilient young stock. By protecting these fragile transitions, we ensure the strength of the future herd. Thanks for watching. If you found the material interesting and useful, please hit the like button and subscribe for more videos. See you soon.